A spike in infant deaths here in Texas and across the country has medical experts reminding parents to follow safe sleep practices. Dr. Edgar Navarro-Garcia of Harbor Health is a board-certified pediatrician. He joins us this morning to talk more about this. First of all, thank you for your time. Thanks for coming.
Thank you for inviting me.
And before we get into the dangers of what we're discussing, let's talk about some stats that came out. Cook's Children's Medical Center up in Fort Worth reported 33 infant deaths from last January to this January. That is a really high number.
Yes, and it's a concerning number because especially like AAP, the American Academy of Pediatrics, has been following all these cases of infant deaths. So we have like a steady rate for the last 10 years, and we have seen an increase in the number of cases in the last couple of years. At the beginning, we were concerned if it was COVID related, that COVID was the cause of like these infant deaths, but on further research, we noticed that it wasn't related to that, but it was related to other triggers.
Yeah, and so let's talk about unsafe sleeping habits. What are the dangers of sleeping with your child?
Absolutely, and this is like so important. Every time that parents come to the clinic, a lot of the time that we spend with them is giving education in regards of like safe sleep. First and foremost, the most important thing that we need to remember is a baby should always sleep by himself, by herself, right? We're talking about their own crib, their own bassinet. Never co-sleeping in the same bed as a parent, right? Because the risk of the infant death is going to increase if we do the co-sleeping.
So what should we not have in the crib?
That's a great question. Now, the most important for us to remember is only the baby in the crib. No pillows, no blankets, no plush toys, no bumpers, no nothing.
Wow.
No soft bedding either, right? We want to have a firm surface when we're talking about what is the crib.
So what is allowed in a crib?
Just the baby.
Just the baby. There's the baby. Okay, so how can you still feel close to your child and care for him and her without co-sleeping? Because the CDC came out with a study that 60% of parents, they like co-sleeping with their child.
Yes, and one of the main reasons is a cultural aspect, right? So that generation over generation that is like, oh, well, my grandparents used to sleep with my parents and so on, right? So there's a generational thing there. Now, what can you do in those situations? Education, absolutely, right? You can share the room, but you should not share the bed. What do I mean with this? Yes, your baby can be in the same room as you are, but should not be on the same bed. You can have the crib, you can have the bassinet next to your bed, but in no circumstances you should have your baby on the same bed.
Yeah, because the numbers are there. We didn't even mention that the CDC reporting 3,400 infant deaths. That is a lot across the country, of course.
Absolutely, and that's all the stats. That's what it tells us. It's like we have that high number every year. I mean, it has remained sort of steady. And reasons why we saw that increase is this social determinant of health. Like we saw a high increase in the low-income families, people that didn't have a job, like the home setting, or maybe like people that don't have a house to live at. You see those families that they're all living crammed together, so sometimes it's just one room for the whole family. And this is like an increased risk for this kind of situation.
Well, Dr. Edgar Navarro-Garcia with Harbor Health, thank you so much for joining us and raising awareness about this important topic. Hopefully we can reverse the trend here.
Absolutely, hopefully.
Right. Thank you so much.